welcome to Melissa from Akiba, Roho.
1/4 of adult deaths in Kenya are due to non-communicable diseases. These deaths are largely preventable, and these conditions are more likely to impoverish families than an infectious condition. My name's Melissa. I'm the founder of Access Afya, an affordable primary healthcare company, and I'm going to tell you about a product that we launched last year called Akiba Roho, which means save your heart, to prevent unnecessary death and make treatment more affordable. Our solution is both high-touch and high-tech. A patient journey has 3 key touch points. First, they meet us in the field. Our healthcare workers with clinics in a backpack get out and screen people as conveniently as possible. In their backpack is a phone that has a screening tool that prompts workers to ask questions like, do you smoke, or do you have a family history of NCDs? And also to take measurements like their blood pressure and blood sugar. At the end, it displays a risk score, and that score helps the health worker and patient decide if they need to go to our clinics for further diagnostic work. At a clinic, they're greeted by a Kenyan clinical officer. If a diagnosis is confirmed, they work on a treatment plan together. Supporting our clinical officers are decision support tools. This is like a digital guide reminding you of the right questions to ask or the right investigations to consider. Telemedicine program so that they can connect with a higher specialist, like a cardiologist, as needed. And in between visits, they can use Access Afya Training Academy so that they can stay up to date with the latest evidence-based information. Also in between visits, we're in touch constantly via SMS that does both behavior coaching, but also appointment and medication reminders. Our clients are Kenyans living in informal settlements. They work casually for themselves. They're usually uninsured. By coming to our clinics, they're saving 66% compared to the other competitive options that are available to them. This means in the last year, Access Afya patients, Akiba Roho patients have saved $18,000 US. Akiba Roho is part of the services we offer at Access Afya. It's contributed for around 10% of the $70,000 that we've earned to date this year. Our team is full-time based in Nairobi. We're mostly Kenyan with diverse backgrounds. We've been working on affordable healthcare clinics for 6.5 years, and we're starting to really get our model right. We're tripling the size of our ground operation this year with 10 new sites. Akiba Roho scales alongside our primary healthcare clinics to ensure that NCD care is available in all of these new communities. Our immediate growth phase is focused on Kenya, but we know that the problem we're solving is echoed throughout the world. And when we think about scale, we think about partnering with other organizations and governments to get our knowledge and insights into new communities. And that's something we hope people in this room can help unlock with us. Thank you.
We'll now take a couple of questions from the judges. Julie.
Thank you so much.
Thank you.
Answered all our questions. Mine is just a comment, really. It's such a fantastic end-to-end solution for NCDs that most of us are focusing on the other side as well. So take some time to think through scaling strategy beyond Kenya, even if you can start with regional East Africa and then move to all the other regions or globally, really. So I think that's where I missed your scaling strategy. Beyond Kenya, because all your staff are Kenyans and they're sitting in Kenya. So how do you want to move beyond that? Thank you so much.
Absolutely.
Cheryl.
Thank you. Congratulations, another fantastic pitch as yesterday. It's really inspiring to see what you're doing in low-income communities. My question is more of a comment as well for this group, and maybe you could elaborate a little bit more for the group on the partnerships that you're looking for from the Solve community.
Yes, probably twofold. So a huge investor in Akiba Roho has been Boehringer Ingelheim, and I know that there's been a lot of companies and corporates that are looking to combine some of their interests in making an impact with learning about a new market and a future and growing market. So I'm sure that there's other organizations like BI that is thinking about new innovative business models, and I'm sure some people in this room maybe know people like that can continue to invest in our growth. And second, scale. So you're completely right. All of our work is in Kenya. And when we think about scale, we think about potentially regionally we can expand. But to really blow this out worldwide, we want partners to adopt the model. And whether that looks like a franchising partnership or a white labeling or advisory one, we're not sure. And so I think Solve and the community here can really unlock conversations around how do we get to West Africa, where context and language is different.
Thank you so much. What type of training do your community workers have?
So,
Both those who are in the field and those who sit in the office. What's the basic training?
yeah. So we hire from the CHV pool, so kind of the government's community health volunteers. We hire them, we pay them a minimum wage with benefits. We train them specifically on screening. So we try to keep it very tight and focused. How do you do blood sugar, blood pressure? Why does it matter? What are questions that are going to come up in the community? How do we answer those questions? We also give them basic tech training. The tools are designed to be very easy to use, but ensure that they know how to use them. For our COs, we tend to do a 3-week immersive program before they start seeing patients, where they work alongside some of our best performing clinics. We've divided our diagnoses. So we have diabetes, hypertension, but also our FP, family planning program, infectious disease program, into like the top 10 conditions. And so that is highly structured and standardized training. When I talk about Access Afya Academy, it's a combination of
Thank you, Melissa.
Okay.